Namaste, everybody. Delighted to see you all here. Welcome to the Sundays with Sattva program. We've been off for a couple of weeks because our sister Pooja was traveling. So we were taking a break. But we are now back with a bang. We want to bring Dr. Aniket Inamdar before you. He is our good friend, my brother. He happened to be a participant in our Sattva program as well. He is already a doctor. He is already an MD physician. I'm going to share with you his CV, very, very impressive. So this is what Dr. Aniket Inamdar is. He's a consultant physician at Samarpan Clinic in Omerga in southwestern Maharashtra or southern Maharashtra. He has an MBBS, MD, D.N.B, A.C.N.C.D, all these fantastic acronyms. We are very proud of him. Postgraduate course in Endocrinology, Metabolism and Diabetes by European Society of Endocrinology. Successfully completed National Diabetes Complications Program by Royal College of Physicians, Royal Challenge. See, look at my challenge. In April 2019, he's a member of American Heart Association, European Society of Endocrinology, European Society of Cardiology, Asian Pacific Society of Respirology. He's presented many papers in prestigious international conferences, awarded the Distinguished Education Award in Asian Pacific Society of Respirology, first prize in oral research presentation in Annual Conference of Research Society of Study of Diabetes in India. Then he has presented a research paper on harmony of breath and mind, essence of yoga, at the International Yoga Conference at Vivekananda Rock Memorial in Kanyakumari in 2020. Besides being an accomplished physician, well-read, Bahushrut, he is also deeply interested in the Gita, Bhagavad Gita, as well as Jnaneshwari, which is the Marathi translation of Bhagavad Gita by Sant Jnaneshwar. He in fact does Nirupan on Jnaneshwari. I have heard that he's an excellent, wonderful, engaging orator. You will see all of that in the next few minutes. I'm going to hand over the podium to Dr. Aniket. A pleasure having you here. Please share your screen and you can start your presentation. Delighted to have you here. Welcome.
Thank you, Dada. Actually, it's a pleasure for me to be associated with Sattva, and thank you for that kind introduction. Actually, you are an inspirational force for me, Dada, to be on this path, being a physician, but going back to the harmony with my own self and the Mother Nature. Thank you for introduction to this journey on the path to being in the harmony with the nature, Dada. Thank you. Let me share.
You're most welcome.
Yeah, let me share my screen first. I hope my slides are visible.
Yes, you can go into the slideshow mode so that we can see the full screen.
Yeah. Yes. So this is the topic is about the transformation which I experienced with the diet purification, and that transformation I am here sharing with you with a scientific evidence. So Sattva program is one of the best thing happened to me, Dada. To be frank, actually, in the December when I joined Sattva, prior to that, I was actually listening to your one of the lecture discourses on Gita. And meantime, I got interested in this topic of diet purification, and then I eventually joined the program. And then Shweta and Pooja helped me along with you on this journey of Sattva program. Actually, Sattva being truly a program of Sattva. Sattva itself means Sattvikta. So what we call purity, what we can call is as elevation, elevating your consciousness. How we can elevate our consciousness, how we can be more in harmony with ourselves through diet purification. Because what happens over the last few decades, because of too much modernization in the Indian context, in the Indian food patterns and in the food patterns globally also, we have accumulated lots of toxins through the food we eat, through the air we breathe, and through the drinks we drink. So we have accumulated too much of toxins. So how to detoxify yourself? And to detoxify yourself is the process through which we can cleanse ourselves and we can regain our health and we can reverse the premature aging that is happening in our cellular level. So diet purification is the first step through which we can begin this journey towards good health of the not only of the physical body, of the mind also, and ultimately elevating our consciousness and bringing closer relationship with our own self and ultimately experiencing that transcendence. So what the diet purification does. So as we have been accustomed to such kind of a diet, which was not part of the diet of earlier human beings. We have been eating lots of processed and cooked food. And why? Because of these cooked food, what is happening? The natural state of the food, we are breaking that natural state. We are breaking the natural enzymes which are available plentifully in those natural foods. And because of breaking down of all those natural enzymes, all those phytoproteins, all those biophotons which are naturally available in the raw food, because of too much cooking and because of too much processing and addition of lots of additives and preservatives in our day-to-day food, we are depriving ourselves of most important ingredient, what I call and what the Vedas called prana. Prana is the most essential ingredient of a food. But unfortunately, because of evolving food practices and more preference or more favorability towards the taste of the food rather than the nutritional value of the food, we are forgetting this most important ingredient, what we call is prana. And the raw food actually has plenty of prana because it's in natural state. All the enzymes are there to digest that food. Body doesn't need any of its own enzyme to use its enzymes to the digestion of the food. So eating raw food, eating natural food puts very less amount of pressure on our body, especially on the digestive system. And let us see what are the benefits of raw food and how we can detox ourselves through the eating of raw or natural food. So what are the benefits? It increases your energy and stamina. Because as the raw food or the natural food is available in its natural state, it makes the person feel more satisfied, full of energy after eating the natural food. So definitely you will experience a lot of increased energy levels and stamina after starting on this Sattva program. Weight loss is one of the secondary gain that you will definitely achieve. Almost every participant will definitely lose some of the pounds. Some may lose up to 20 pounds also, as our own program have experienced the people losing more than 20-30 pounds itself. Mental clarity, I will come to that, because again, because of some hormonal changes which happens after eating natural food, because of increase in amino acid like tryptophan and increase levels of serotonin and melatonin, it increases our synaptic transmission in the brain, which leads to the mental clarity and improved focus. Definitely eating raw food improves the digestion because it puts very less pressure, very less stress on the digestive system, because nature itself provides lots of enzymes for its digestion of the natural food. So no stagnation, no bloating sensation. So you will see remarkable improvement in your digestive process, and it itself again improves your energy and stamina. So when the digestion improves, ultimately again the organ cleansing happens, because as I said earlier, we have been accumulating lots of toxic materials because of too much of contamination of food, water and air. So organ cleansing naturally happens with the raw food, because raw food has plenty of water, plenty of biophotons, plenty of enzymes in it, plenty of vitamins in its intact form, and without any through the eating of raw food, what we do is unlocking of the nutrient happens. Unlocking of the nutrient is one of the important phenomenon which we must know, because in the process of cooking and processing of the food, we are not unlocking the nutrient completely. What we are breaking down the nutrients, we are breaking down the phytonutrients in the natural food, and we are not getting the optimum benefit of the nature, what nature is supposed to give it to us. So through this process of cooking and processing, we are interfering with the nature's own ability to clean ourselves. So we should not do this. To try to take maximum amount of raw food in the diet, and you can immediately start experiencing the organ cleansing. Skin experiences even the cleanliness. Immediately the pores, the acne, everything will come down. You will see the improved odor of the no bad odors after starting on the raw food diet, because that itself will take care of natural food itself will take care of the organ cleansing. Improved immune function, because as the function of the digestion improves, as the immune function improves, because natural fruits and vegetables, nut contains lots of phytonutrients, biophotons and nutrients in its original form. So they will definitely improve your immune function. Phytonutrients acts as a catalyst in improvement of the immunity. The beta cell immunity, the T cells, all the things will improve. Ultimately, we will also experience the emotional and spiritual well-being. I will come to that later. Disease prevention happens because with the improved immune function, improved detoxification, improved digestion, the body goes into phase of detoxification, elimination of all toxin products, and definitely the body will attain a state of well-being, and definitely a person will prevent the diseases which can be easily prevented, like simple respiratory tract infections can be prevented very well. Even some chronic ailments also can be prevented, such as various heart disorders can be prevented through eating the raw diet. Decreased cravings, one person can easily experience decreased cravings, because eating raw and natural food contains natural food contains lots of fibers, which again makes the person feel more satisfied and full of energy. So decreased cravings will be there, improved confidence will be there, and ultimately you will feel the connection with the Mother Earth.
This is such a wonderful explanation, Dr. Aniket. Delighted that you have experienced all these things firsthand in your own experience.
Yes, Dada.
All right, great, wonderful.
Yeah.
Please.
So coming to the benefits of raw food diet, all the patients with all these sorts of diseases can definitely very well experience the benefits. The patients with the cancer, heart diseases, high blood pressure, high cholesterol, osteoporosis, kidney diseases, gallstones, gallbladder, neurologic diseases like Parkinson's, autoimmune diseases, all sorts of inflammatory kind of diseases. So all these sorts of patients can easily experience the benefits, even reverse these diseases through simple habit of eating raw diet. And what are the benefits? Ultimately, in any chronic disease, two basic pathophysiological mechanisms happen. And what are these two pathophysiological mechanisms? One is inflammation and second is oxidative stress. The benefit of raw diet is that it lowers the inflammation immediately, and it improves the antioxidants in our body, so which take care of oxidative stress. And second thing, it lowers our inflammation levels. So all these sorts of chronic heart diseases, cancers, all the digestive problems the root causes are lying there in the pro-inflammatory state. And because of wrong food habits, wrong sedentary lifestyle, we have been triggering this phenomenon of inflammation in our body. So these raw diets are anti-inflammatory diet. They definitely lower the inflammation. It improves the digestion. It improves the dietary fiber, improves the heart health. I will come to those with some of the latest scientific evidence. It prevents cancer also. It prevents constipation. It treats constipation. It gives you lots of energy. It clears up your skin. It prevents lots of nutritional deficiencies. And carcinogens in our diet, we can very well reduce by switching over to the raw diet. So raw diet, what it does to our heart, let us see by each organ. Because of reduced damage to the blood vessels and anti-inflammatory effect, it prevents the cholesterol and blood platelets clumping together and becoming sticky, and that itself prevents heart attacks and strokes. And in India and in majority of the world, 70% of the cause of mortality is heart or heart-related issues. So, because being an anti-inflammatory and because of its endothelial improving function, raw diet can prevent heart diseases and strokes. Kidneys, because of less excess protein, means less urea, and that needs to be processed. It relieves the stress on the kidneys, and ultimately the raw diet improves raw diets such as watermelon, cucumber. So these are having plenty of fluids, and these again improve the health of the kidneys. Again, because of lightness, because of less pressure on the liver and less toxin generating nature of the raw food itself, puts very much less pressure on the metabolism, and again clearing of the all toxic metabolic effects often occur with the liver. Blood, because of the raw food in its natural form, it's green in color and it's rich in chlorophyll. Again, chlorophyll itself is an anti-carcinogenic and very powerful antioxidant. So it improves the iron deficiency anemia, and it improves the energy levels. Again, coming to the brain, what it does wonders to the brains because of increased synaptic transmission in the brain. High mineral and vitamin content of the raw food makes us more alert, and it improves the mental clarity. Some of the recent studies have shown that by switching to the raw diet itself helps reverse the diseases like Parkinson's disease and Alzheimer's disease, and it is very well has been proven and established by switching over to the raw diet. Teeth and bones, because of alkaline nature, the mineral and high mineral density of the raw food, it itself provides strong teeth and bones. Lung, one of the major feature of the raw diet, it produces very less mucus, and being alkaline in nature and producing very less mucus, your respiratory tract will have a very less mucus, so it will more open to the consumption of the oxygen and expulsion of the carbon dioxide. So this has shown remarkable benefits, especially in the diseases like asthma, bronchiectasis, sinusitis, cystic fibrosis, where there are in these diseases, lots of plug formation, mucus formation occurs especially in the respiratory tract. Switching to the raw diet itself improves your digestive system. It improves your stomach health, improves your satiety, and ultimately it does wonders to the intestines also. It improves your digestive process, all sorts of enzymatic processes in the intestine, the absorption process, and the gut microflora. Most important, the phytonutrients in the raw food improves the probiotic itself. The phytonutrient itself acts as a probiotic, which flourishes the prebiotics in our intestine. So this has again anti-cancerous effects and this also treats the constipation, and in the long term it has anti-cancerous effects on the intestine.
Fantastic. So some of these changes you have done in your own diet, right? So before you were eating mostly cooked food or a lot of cooked food, and now you are eating a lot of raw food, and that's why you have experienced all these changes yourself also?
Yes, Dava. Most of the changes I have experienced in myself, and I have been experiencing in some of my patients who have tried each and every allopathic drug for their constipation, for their so many skin problems also. But when they are started switching to raw food, they are also experiencing these remarkable benefits in their body and mind.
Great, thank you.
So coming to the scientific evidence, I will just go through briefly some of the latest evidence which has come recently in the literature. So long-term consumption of the raw food diet is associated with a favorable LDL, low density lipoprotein cholesterol, and triglycerides. You must be knowing that LDL is a bad cholesterol and HDL is a good cholesterol. But the long-term consumption of the raw diet has demonstrated that it lowers the bad cholesterol and it improves the good cholesterol. High consumption of vegetables and fruits is associated with the reduced cardiovascular disease. The investigation which was done on very extremely high dietary intake of raw vegetables and fruits, almost 70 to 100% of the raw food, on serum levels, plasma, vitamin B12, folic and homocysteine levels. And what they have experienced, we can very well see that there was a negative association between increased intake of green vegetables and fruits and the incidence of coronary heart disease and stroke. So this has been clearly shown in this particular study. Coming to the next study, they have compared the vegetarians versus non-vegetarians. And this study involved a collaborative analysis of 8,300 deaths. And this was published in Cambridge University Press, and which showed that in comparison with the non-vegetarians, those patients who are eating vegetarian diets with lots of fruits and vegetables, they showed 24% reduction in mortality from the ischemic heart diseases. So this is again a remarkable study. So vegetarians with a plenty of raw foods and fruits have lower risk of dying from ischemic heart disease than non-vegetarians. So this is again an important study which showed that what are the benefits of vegan diet. So eating lots of vegan food, it promotes weight loss, it increases your energy levels, it clears your skin, it improves your digestion, and it easier accommodation in the climatic condition. Whenever these persons who are eating the raw diet, they can easily adjust with the climatic changes also. They will not have the routine diseases or routine disorders which people usually experience when change in climate happens. Because of rich content of water-soluble vitamins in the vegan food, like vitamin B, C, minerals like potassium, ferrous, and magnesium, antioxidants like carotenoids, lycopene, and beta-carotene, vital enzymes, phytic acid, biophotons, these are plentifully available in the raw and vegetarian raw fruits and vegetables, and that too in its natural state. You are not interfering with these intact biomolecules, which are the source of important energy and nutrients to our body. And what are the ultimate effects on the human health? Eating raw vegan food is associated with the increased longevity. It reduces the incidence of cancer and cardiovascular diseases, and it shows positive results on other chronic diseases also. The studies have shown that there is remarkable improvement in the fibromyalgia and rheumatic arthritis symptoms, which are the inflammatory disorders. And people who switched over to the raw diet, they experienced very less symptoms of fibromyalgia and rheumatoid arthritis. Even the C-reactive protein levels, which itself is an inflammatory marker. So there has been decreased levels of C-reactive proteins, low levels of LDL, and improved levels of HDL. The researchers have experienced in various studies. I will come to this important topic of discussion, because lots of people, researchers nowadays, they blame that the nuts contain lots of saturated fat. So do not eat nuts. But this is the recent paper which shows the proportion of saturated fat with a mono or unsaturated fat in the nuts. If you see the total amount of fats in almonds, it's 14.5, and the saturated, actually the bad content, the saturated content is only 1.5. Mono unsaturated and polyunsaturated is plentiful. You can see the difference. So mono unsaturated fats and polyunsaturated fats are very essential for our development of our brain, and they are having the remarkable antioxidant property, anti-carcinogenic property, but they are blamed for no reasons. See the saturated fat content in almond, it's negligible. See it in Brazil nut, see it in cashew, see it in hazelnut. Total of 18 grams, only saturated fat is just 1 gram. And why they are blamed for saturated fat contents? Don't eat nuts. Actually, nuts are very healthy. They are the powerful source of all antioxidants nature provides in a very tiny pieces. So everyone should include lots of nuts in day-to-day habits, because they have very negligible content of saturated fat and very high amount of monounsaturated and polyunsaturated fats, which are essential for the synaptic transmission in the neurons, which are essential for the prevention of cancer, which are essential for anti-inflammatory effect. So one should eat plenty of nuts in our day-to-day diet. So
one of the things
diet,
I'll interject here, Dr. Aniket, if you don't mind.
Yeah.
We do recommend eating a lot of nuts.
Yes.
But what we try to do is overnight we try to soak them.
Yeah.
Then they become much easier to digest. The fat also becomes easier to digest, and the toxins the nut covering may have.
Yeah.
That toxin is released in the water, and we throw away that water. We wash the nuts, and then we can eat those.
Yes.
Those are very helpful. Thank you.
Yes, Dada. Yes, sir.
And also, I would like to add, Dr. Aniket, that there was a study conducted in my department itself when I was doing my MSc dietetics. There we had the School of Health Sciences also. So there one study was being conducted on soaked almonds. So they found that in raw almonds, the amount of vitamin E and omega-3 is less compared to the amount of soaked almonds. And this was proven there. They were conducting that study when we were studying over there. So soaking actually helps improve the bioavailability of those nutrients is also high. Plus the actual amount of those nutrients went up when they were soaked and then consumed.
Actually, the essence of soaking is it improves the bioavailability, which you said rightly, Shweta.
Yes.
And it improves, it becomes very easy for digestion also.
Exactly. True.
Because lots of people who eat nuts also experience some of the digestive issues like bloating and those things. And that these can be very well taken care by soaking them overnight.
Yes, true.
So prudent diet usually consists of vegetables, fruits, legumes, and whole grains. So these are the main ingredients of prudent diet. I will not go to the Western pattern because this is again a comparative study. So I will not waste my time here. So what is the scientific evidence? So recent cohort studies have clearly shown that high consumption of plant-based foods, such as fruits and vegetables, nuts and whole grains, is associated with a significant lower risk of coronary artery disease and stroke. And these protective effects, why are they occurring? Because of plentiful of mono and poly unsaturated fatty acids in fruits and vegetables, omega-3 fatty acids, antioxidants, vitamins, minerals, phytochemicals, fibers, and the intact plant protein. So these are the ingredients in these raw and natural food which are preventing us from having coronary artery disease and stroke. Again, number of prospective studies. One Finnish study of over 5,000 men and women showed that there was an inverse association between the intake of fruits and vegetables and risk of coronary artery disease. So higher the intake of fruits and vegetables, lower was the incidence of coronary artery disease. Again, a subsequent analysis showed inverse relation between flavonoid intake and major sources of flavonoids such as apple, berries, and coronary artery disease and its related mortality. So again, the natural diet contains lots of flavonoids, and it again reduces our chances of getting these dangerous diseases. A Framingham study from UK, this is one of the remarkable study. We call it as a landmark study. It again showed a significant inverse association between the total vegetable and fruit consumption as assessed by a single 24-hour recruitment and incidence of ischemic stroke. Again, it has beneficial effects on stroke disorders. So those people who had more vegetables and fruits, they had very less chances of getting ischemic stroke or ischemic neurological paralysis. A physician's health study again revealed that even inverse association between the vegetables rich in carotenoids such as broccoli, carrots, spinach, yellow squash, and tomatoes, and again having a risk of coronary artery disease. So higher the intake of fruits and vegetables, the lower the risk of coronary artery disease. So this is again a meta-analysis showing higher intake of fruits and vegetables clearly. So everything is left to the left side of the hazard ratio. So you can clearly see all these studies clearly shows the benefits in favors of fruits and vegetables. Nuts again shows benefits in favors of fruit nuts, and again the whole grains also, consumption of whole grains again shows favors in the prevention of the diseases. So eating lots of fruits and vegetables, eating nuts, and eating whole grains, these all studies have clearly shown it improves our health and well-being, and it reduces our chances of having coronary heart diseases and stroke. So one of the recent article, which I request everyone to go through this, and it's available free on the web, and it is from the New England Journal of Medicine. And this is a review article, and which this is the last part of my screen share, because I will come to this important topic, which is an integral part of Sattva program, intermittent fasting. What are the effects of intermittent fasting on health, aging, and disease? And what this review article has clearly shown that by switching to the intermittent fasting, maybe 16 hours to 8 hours ratio, what it induces, and because of this caloric restriction, what happens at the cellular level? So it induces neuroendocrine signaling. It increases the chances of cyclic AMP to the ATP. It reduces the mTOR signaling pathway, and it reduces the levels of insulin at the cellular level, and it improves the metabolism of protein, carbohydrate, and fats, and ultimately leading to autophagy. Autophagy means body's own ability of clearing its dead tissues and dead proteins and repairing itself. So this is a wonderful mechanism which occurs because of intermittent fasting. Autophagy is one of the main mechanisms which has been proven that autophagy helps in a longer health horizon. So it induces the stress resistance, it produces proteostasis, it induces autophagy, it improves the glucose and lipid metabolism, and ultimately what happens with the mitochondria, it improves the mitochondrial biogenesis, it improves the energy levels, and ultimately cell repair and cell survival improves. And it because of all these effects, what it does on the overall health and well-being, it improves the health and stress resistance. So this occurs just because of intermittent fasting. So this is again a slide. When we go through a period of intermittent fasting, it causes systemic and cellular adaptations to the bioenergetic challenges like ketogenesis. Increased levels of ketones will be available, increased mitochondrial stress resistance will be there, increased antioxidant defenses will be there. Because of increased autophagy, there will be DNA repair, which will be happening at each cellular level at our body, decreased insulin, decreased mTOR pathway, and anti-inflammatory effect, ultimately leading to the resistance of the cells and organs to stress, especially the metabolic, oxidative, ischemic, and proteotoxic. So body is able to resist all these sorts of stress which body goes through. And during the periods of recovery, what happens? Because of systemic and cellular adaptations to the energy depletion, increased glucose, increased insulin, increased mTOR, again the cell growth and plasticity occurs, and structural and functional tissue remodeling occurs at the cellular level. And what are the long-term? Because of long-term adaptations, what happens? It increases insulin sensitivity, it increases the heart rate variability, it improves the lipid metabolism. Healthy gut microbiota is one of the important long-term adaptation which occurs to the intermittent fasting. It reduces the abdominal fat, it reduces the inflammation, and ultimately reduces the blood pressure, and overall resilience of the body and the disease resistance improves. So these are the all benefits of intermittent fasting. One of the neuroscientists, I just don't want to forget his name. He is from John Hopkins, and his name is Mark Mattson, who has studied the intermittent fasting for 25 years. And what he has shown clearly in his research, which was published in 2019 in an NEJM article, the intermittent fasting improves thinking and memory. It improves because fasting boosts the working memory in the animals and verbal memory in the adult human. It improves the heart health because it improves the blood pressure and the resting heart rates. It improves the physical performance. The young men who fasted for 16 hours showed less fat loss and while maintaining the muscle mass. And even in rats also, it showed improved physical performance. In animal studies, intermittent fasting has prevented obesity and diabetes, and overall tissue health also improves a lot. These are the animal studies where the intermittent fasting has shown remarkable results. So this is my small presentation, where I have shared with you some of the latest evidences of intermittent fasting, some of the latest evidences of raw food diet, and how it improves our heart health, how it prevents the coronary artery diseases, how it reduces the weight, how it improves the cellular functioning, and ultimately overall well-being. Thanks, Dada, for allowing me to share my screen. Thank you.
You are most welcome. Once you stop sharing your screen, then I'll ask you a few questions regarding your own journey.
Yeah.
So initially, before joining the Sattva program, see, you are a medical doctor yourself. So when you joined our program, we thought, my God, there is this MD physician who is going to join the program. What are we going to teach him? We cannot teach you anything, isn't it? So I thought, we will share with you what we have learned, and we'll say, okay, you try these experiments yourself. And you are not only an MD physician, but you are interested in the spiritual aspect of life. So tell us about your own journey, what experiments you did, how the changes were observed, and how are you feeling right now?
The first thing I changed in my dietary pattern is the basic do's and don'ts, which Dada usually tells. Do not eat unless you are hungry, and do not drink unless you are thirsty. So that rule I started following from the day one, and I immediately started experiencing the benefits of this rule itself within 2 days, Dada. because when I stop the munching in between or snacking in between, because munching or snacking in between again puts lots of pressure, lots of stress on your digestive system, and that again the body tries to metabolize these sorts of cooked and digestive whatever the processed food. It puts lots of pressure, so that will divert the body from the vital functions like improving immunity, improving cellular repair, improving cellular signaling methods. So again, the body diverts its energy from these vital processes to the digestive processes. And when you start experiencing these 2 times eating or whatever 3 times eating whenever you are hungry, that again reduces lots of load on our body, and it immediately gives you the feeling of high energy, high stamina, improve mental clarity, and improve focus. That I started experiencing within 2 days itself. Then what I started doing, then I started to increase my raw content, because I immediately in the beginning itself, it is not advisable also to increase the raw content immediately to a very high levels. So slowly and steadily, I increased my raw content and natural state of food in my diet. And what I experienced, I'm having the best mornings of my life, Dada. Because what is my daily pattern? I usually eat around 10 o'clock in the morning and 5:30 in the evening. And I do 16 to 17 hours of intermittent fasting every day. Still, and in the morning when I wake up like just a newborn baby. So that kind of enthusiasm, that kind of energy I have more profound meditations these days, Dada, because of more mental clarity, more profoundness. I have more flexibility in my postures. My postures have improved a lot because of these natural diet, these raw diet. So I have experienced immense benefits. And some of the benefits which I wanted to share it at the last, I lost almost 10 pounds in the program itself. And after the program, I lost almost again 4 to 5 pounds, Dada. Almost 3 inches of my abdominal girth, I lost it. And my weight is now my optimum to my body weight. Actually, I was not overweight itself from the starting of the program itself, but I experienced immense health benefits in terms of better digestion, improved immune function, improved sleep, because again, sleep is one of the factor of integral part of the health. Unless you have a good sleep, your immune function, your cellular function will not improve. And what happens with the natural and raw diet, because of lots of amino acids in the natural and raw diet, it increases the amount of serotonin and melatonin in the body. And this melatonin is a sleep inducing hormone. And when the melatonin is increases in the body, that you will get immediate sleep. Once you just hit the bed, you will immediately start experiencing the deep sleep. And second thing, it improves your slow movement sleep. So there are different types of sleep. So actually slow movement, rapid eye movement sleep. But when you experience more amount of slow movement sleep, you will go deep into the sleep patterns. You will have a more relaxed state of body and mind. More repair and recovery occurs in that state of sleep, which again improves your health function. So these all experiences I have very well experienced, Dada, with the Sattva program.
Fantastic. We have many questions from our participants here who are here. Our sister, Dr. Aruna Turk, wants to know, if you eat soaked almonds in the morning, is that okay? Or should you eat them at night? Is there any benefit on our hormone serotonin? I think she means serotonin, if I'm not wrong.
Yeah.
If eaten at night time. Do you have any thoughts on that?
Actually, all sorts of nuts contains the one amino acid, tryptophan, Dada. And tryptophan is a precursor of serotonin and melatonin. So tryptophan again helps to induce better sleep, and it's a mood elevator also. So tryptophan again does remarkable effects, has remarkable health benefits in terms of body and mind. So you can also advise that soaking almonds overnight is a good, because it improves its bioavailability of the nutrients. It keeps the nutrient. It improves its absorbability. So that is again a major benefit of soaking the almonds overnight. So soak it overnight and eat next day in the morning. That will have we can experience its immense benefits.
One of the things I would like to add, Arunatai, is you should not eat almonds, whether at night or in the morning, unless you are hungry. Only if you are hungry, you should eat that. What happens is when we are hungry, then our body has already secreted the enzymes that are necessary for digesting the food. Unless those enzymes are digested in the body, which means that we have the signal of hunger. If we put anything into the body, then it will not be digested properly. What we recommend is eating only during sunlight hours. So when the sun is up, only then you eat. The best digestion and assimilation occurs in the 10 to 2 period, 10 a.m. to 2 p.m. So when the sun is up in the sky, that is the time of pitta according to Ayurveda. During that time, if you consume the food, that food gets digested and assimilated properly in the body. In fact, in my case, I try to eat one meal usually around say 8:30, 9 o'clock, a smaller meal, and then I'll have a larger meal say around 1 to 2. Thereafter, I won't eat until the next morning. So whatever is eaten during those 2 meals, that gets completely digested during the fasting period. And then in the morning, as Dr. Aniket has just indicated, you will wake up like a baby, always. It's a lot of fun. Dr. Prabhat, oh, go ahead, please.
No, go ahead, sir. I was going to ask Prabhatji's question.
Why don't you go ahead and read that question out?
Yeah, so I think he says that we've heard about a lot of benefits of intermittent fasting, but are there any disadvantages or are there any signals that we should watch out for while practicing intermittent fasting?
So any thoughts, Dr. Aniket? Yeah, no, Dr. Aniket, let me hear your thoughts on that. If there are any disadvantages, or in your practice, have you seen any patients where raw diet might not have been suitable for them? And if there are any things we should be careful about? Go ahead, please, Dr. Aniket.
Especially age factor.
Can you repeat that question because I lost the connection actually in between?
Prabhatji, why don't you ask the question, because you are already online and unmuted. Go ahead, please.
Okay, sure. Actually, of course, we have heard about intermittent fasting quite a bit from several sources, including Sattva, and I've been practicing also actually to a large extent. What I'm wondering is the opposite side, meaning, in anybody's experience, including Dr. Aniket, if there is something that one should watch out for, and especially age could perhaps be a factor as well, So of course, many of those things we learn from experience, but in your experience, in your, experience of your patients, have you heard anything that one should really watch out for while practicing intermittent fasting? Thank you.
Yeah. Sir, intermittent fasting, you have to individualize the approach, doctor. Most of the times what happens, the 16 hours to 8 hours ratio will not be suitable for most of the patients also, because in the beginning itself, if we start to put the patients on 16 to 8 hours fasting, that may induce some of the pre-diabetic and diabetic individuals again at a higher risk of hypoglycemia and other side effects. So initially, you just ask them to start on some like hours of 6 to 8 hours of intermittent fasting, and then slowly increase hour by hour or 2 hours in a week. So gradually you can adopt these mechanisms as per the individual need, because everyone's glycemic variability is different, sir. So there is no fixed rule that everyone has the similar kind of glycemic variability. So as the patient's glycemic variability differs, so we need to individualize the ratio of intermittent fasting as per the patient's and person's requirement. And if most of the centers are using the glucose sensors, so they track the 1 week's the glycemic variability, and accordingly they will suggest the intermittent fasting pattern. So that usually helps a lot, but not all the patients will afford the glycemic variability testing or glucose sensor testing. But you can, with the advice of individualization and seeing how he responds to 6 to 7 hours, 8 hours, 10 hours, 12 hours of fasting, then we can definitely increase the fasting pattern, and patient can experience the benefit.
Exactly. And I would just like to add something. what we do in Sattva is that first we take a recall of the participants, and when we understand that suppose if somebody is not able to do even 12 hours fasting, we just try them to increase it by half an hour, say suppose for 1 week, because it is a 90 days program. So what we do is we try to increase it gradually, like how Dr. Aniket said, we and gradually ramp it up, because immediately if we try and put them on that kind of eating window and fasting period, then it's not at all possible. Even for normal individuals, it becomes difficult for them to follow it. So what we do is we try to increase it 1 hour every week, try to see and let them experience what happens when they increase it by 1 hour. So either we ask them to have the breakfast late, or we try and ask them to have the dinners early, whatever is possible and feasible according to the individual's routine, whether they are working or whether it's a housewife or whatever it is. So individualization of whatever intermittent fasting and even the raw food percentage is very much essential, and that is how we actually need to do it.
Great. Thank you, Shweta. I was going to add about the age factor. As Dr. Prabhat has correctly pointed out, age could be a factor. So if you are elderly, see what happens is during our childhood, our kapha is more predominant, which means the building up of our body is more predominant. Then thereafter, the pitta aspect of our personality is more predominant as we are adults until about say 60 or so. Beyond 60, the vata aspect of our personality may be more predominant. So during that time, it may or may not be suitable for everybody to eat raw food. See, if you eat 100% raw food, food will have to be tackled by Agni. Food will have to be digested by Agni. Food will have to be processed by Agni. The fire principle. Unless the fire principle is strong, raw food may not be digestible for everybody. What you're saying, Dr. Prabhat, is actually right. So if the digestive fire is not strong enough, then raw food may be a bit challenging. All right. So what we do is we try to figure out what the level of the digestive fire is within every individual. If your digestive fire is good, then you can digest raw food very easily. If not, you gradually build up that digestive fire through intermittent fasting. Intermittent fasting will improve your digestive fire. About that, there is no doubt. When you don't fast regularly or when you're eating all the time, then your digestive fire will be low because you are putting more earth element and the water element into your body, and the fire element will be lowered. So when you stop adding the earth element, which is the solid food, or the water element, which is the drink, any kind of liquid. See, even natural food has mostly water, isn't it? We make a smoothie out of our natural ingredients. It's mostly 70-80% water. When we limit the amount of solid and liquid material going into the body, then the fire principle becomes more predominant. So we have to improve this fire. See, think of the example of our ordinary plants in the garden. If you soak the garden in water all the time, then the plants will die. That is exactly what we are doing to our body, or the fire within our body. So not only is water necessary, but some sunlight is also necessary. The air principle is also necessary. In our body also, there is a balance of all the fundamental 5 elements: the earth, the water, the fire, the air, and the space. If that balance is disturbed because we are putting a lot of earth and water element into the body, then the fire element will get suppressed. So we have to let that grow. Fire element will improve through intermittent fasting. So once we do that, then raw food will be better digested. That is what will happen. So that's why, to answer your question in a simple language, not everybody can do raw food or raw diet on day one. In fact, most of the people cannot do. Only some exceptional people like our sister Pooja here can do 100% raw from day one. Because once she heard, Pooja, maybe you should tell your experience shortly. Why don't you go ahead, please?
Yeah, so I started on this diet about 3 years ago, and my major reason to start the diet was weight loss. And when Dr. Vikram explained to me the principle of natural diet, I found it so convincing that I started on 100% raw right from day one, because I was so motivated to lose weight. And I did not face any issues as such. In the beginning, it did feel a little difficult to wait till I'm hungry to eat, or sometimes I did get some cramps. I think my body was trying to adjust to the new diet, but then soon within a week I got used to it, and the feeling was so awesome that my taste buds automatically started changing, and I started appreciating the natural taste. I liked the sprouts and every vegetable without adding too many spices and all that. My cravings started going down, my energy started going up, and then I started losing weight as well. So the reason I started was for weight loss, but then there were so many other benefits that I realized that the whole experience, the whole quality of life improved. And it's been 3 years and I'm still practicing the diet. And in fact, that is what motivated us to even start Sattva in the first place. So yeah.
See,
that
what has
was
happened is
my
everybody who has gone through this Sattva program, everybody who has done this experiment sincerely and consistently has experienced the benefits. It happens. Sometimes what will happen is, Dr. Prabhat, in answer to your question, sometimes there will be excessive weight loss. It does happen. So we have observed in the case of many participants, including myself. The way I explain this is like this. Okay, so imagine a pendulum. Okay, pendulum. Then you raise it to one side. So the pendulum is out of balance, isn't it? So from here, if you let it go, the pendulum will go towards the other side first, because it has that momentum. And then eventually it will come back to normal. So in my case, my weight was 80 kilograms when I seriously started on this diet purification program. From there, 80 kilograms, the weight went down. According to my height, my weight should be anywhere between in the 60s. Okay, 60 kilograms. 60 to 70 kilograms should be the range. Okay, so it was 80 kilograms. So it was 10 kilograms above at least, right? My height is 5'8", which is 68 inches. So they say ideally my weight should be about 68 kilograms. All right. So from 80 kilograms, it went down all the way to 62. And I started looking quite thin. So people were wondering what happened to me. But I kept on doing, because I was convinced about this detoxification diet. All right. I knew that natural diet would detoxify me. And I was feeling great from within. So even though my weight reduced, I was feeling wonderful. Eventually that weight kept on coming up. And it settled down somewhere between 65 and 70. So sometimes it goes up to 70, sometimes it goes down to 65. I don't worry too much about it. It depends upon how much I eat. It depends upon how much I work out, or how much I am exerting myself, or how much I'm fasting. I know exactly how to reduce weight. I know exactly how weight goes up. So I try to maintain that balance. I try not to overeat. Sometimes you may have to overeat, because sometimes, as a householder, there is something that needs to be finished. So, okay, you finish it. It's okay. Sometimes you may eat slightly more. Then you wait longer until the following meal, until you get hungry. If we do that, if we consistently do that, if we maintain a mostly raw diet, then our body will take care of itself. Body is run by nature, and nature is supremely intelligent. So once we let nature decide what it wants to do with the body, and we monitor the inputs, all we do is make sure that we put the right kinds of things into the body, and then let body take care of itself. How do we explain all this? Dr. Aniket gave such a fantastic technical talk. Okay, most of it probably went way above our head. All those technical terms, all those diagrams, and beautiful picture of mitochondria and all that. We don't understand any of this, right? What can we understand? Ordinary people, we will understand that I'm hungry. Okay, so when I feel hungry, my body is telling me, okay, put some food into it. So then when we put food into the body, we feel good. Once we follow that rule, just like Dr. Aniket has told us, initially you follow this one rule. I shall not eat until I'm hungry. So when we follow this rule for at least 2 or 3 days, then gradually we'll start understanding as we practice it consistently, continuously, then we will understand what kind of food is good for us. So then we tell people, okay, if you like cooked food, that's fine. If you liked, we don't really tell people to quit everything at once. We say, okay, whatever you like, you eat, but follow this one rule. Then we try to substitute one of the things that they are eating wrong with one of the things that they should be eating. So we try to substitute the wrong things with the right things over time. And then everybody gets such a wonderful experience of health and wellness from within by eating the right kinds of things. Only when we are hungry, by the way. That rule is never broken. I shall not eat until I'm hungry. That rule is never broken. And within that, we try experimenting with substituting what should not be eaten with something that should be eaten. Then our experience improves. Now, if something is working well, why will we not continue it? Once we have experienced the difference between right kind of food, right kind of attitude, right time of eating, right amount, all of those things when we have experienced, then we will not go back to the earlier way of life. So our lifestyle changes. We don't tell people that, you should do this from day one. No, you should not do that. You should gradually come to the right track. That's how we advise people.
Dada, I just want to add.
Go ahead, please, Dr. Aniket.
Dada, what I experienced in my initial days of Sattva program, because initially when I started following the rules of don't eat when you are not hungry until you are not hungry, and don't drink until you are not thirsty, I started experiencing 2-3 changes which I want to share with you all. The amount of food, whatever food we eat has immediate and delayed effect on our physical and mental level. If we eat lots of processed and cooked food, I immediately start. Actually, I was eating earlier to this Sattva program also, but I started experiencing its effect on mind and body once I was introduced to this program. So when I used to eat lots of processed and cooked food, I used to feel lethargic, and very heaviness was there in the bloating sensation was there. Heaviness was there in the body and mind, both sides. But when I switched over to the raw diet, immediately within hours itself, so you start experiencing that lightness, that improved energy and improved stamina and improved mental clarity. Whenever you have some kind of cooked and raw cooked and processed food, you will not have that kind of mental clarity and lightness and improved energy. But when you switch over to the natural food and raw food, you immediately start experiencing these kinds of high energy levels and improved clarity, mental clarity, and improved amount of sleep also. So which I started experiencing initial days of such program itself.
Fantastic. So our sister Bula Didi is saying, Bula Ghosh, I have been doing Sattva principles for more than a year now, using the concept, but she's taking baby steps and she still lost 22 pounds. Just imagine. We have another sister here, Bela Didi, and her husband Matu Ji. They have been in the program for the last 3 months now. Bela Didi, is that it? And during that time, they haven't really done 100% because they have an active social life, and we don't advise. We say, okay, you enjoy your social life. You should not feel deprived. So Bela Didi, why don't you share your experience? Will you please? Thank you. Great.
Sure. Yeah. We have been doing this program, and the first week was disastrous. That's the word I can use. We felt, oh my gosh, we are in our 60s and 70s, and we said, oh my gosh, we have a 15 to 20 years of our life, and this is how we're going to live the rest of our life, when we enjoyed food all our life. And in our household, up to the point, my husband and I, we have 2 separate shelves for snacks because of different taste. We were that much into food that we had separate shelves.
This is called, Bela Didi, this is called your serious foodies. You're not ordinary foodies, you're serious foodies.
Yeah, we are very serious foodies. So in first week. So then we told Dada, after 1 week or 2 weeks, we feel so deprived. All this good food around us when we socialize, we do socialize a lot. So with that, we said, okay, slowly we'll try to do. And especially being a vegetarian, I really disliked salad. We hardly ever eat salad because we like fresh and hot food. So with this, it's a challenge we felt, but slowly and slowly, we were convinced that it is good for us. And I try to be more creative with my salads and try to make it look more appealing and appetizing, and try to make different ingredients. Like, and my salad, this is my cooking now because I love to cook. So I put 10 to 15 items in my salad every time I make a salad. So that way, at least I feel now I'm cooking and I will make it look pretty and it looks appealing. So we will eat it. And we are loving it. I'm making my own dressings even. And we cannot do it, for instance, 100%. So we try to do the best we can. And we have lost several pounds, my husband and I together. We have lost several pounds in double digits together.
Great. No, that is wonderful. That is fine. Dekhiye, we can lose weight and we will lose weight if we do these things right. If we follow the principles that have been told to us, to the extent you follow, you will lose weight. About that, there is no doubt. And you should feel good. While on the journey also, you will feel good and you should feel good. Otherwise, it is not worth it. No, see, otherwise you will feel like, we have put you in jail. That's not what we want to do. Our brother here, Dr. Prabhat, wants to share something with us about his fruit diet. So why don't you go ahead and share, Prabhatji?
Thank you, Vikramji. Very quickly, actually, I have been eating a fruit diet kind of during the day. It's really one meal, maybe sometimes half a meal later, maybe 1.5 meals sometimes. So it's not just one time, sometimes 2 times. So what I have noticed that, after the fruit diet, I still feel empty stomach, after a few minutes. And also I may feel hungry, but then the energy level is really, really high and I don't need to eat. So that is something, my personal experience I wanted to share.
Fantastic.
That's also, so keep in mind that, that your energy level, despite your feeling empty in the stomach, is high on these raw fruit diets.
Great.
Thank you.
Thank you,
Dr. Dada, I want to add an explanation for this feeling.
Go ahead.
Why it would be happening? Because when you switch to this fruit and raw vegetable diet, body needs very less energy for digestion of these diets. And actually, what happens when we eat too much of cooked and processed food, body needs a lot of energy to digest these foods for at least 3 to 6 hours. So whole the cellular processes and whole the vital processes of the body, which requires lots of energy, are getting neglected, and all the energy and the stress has been diverted to digestion of these heavy cooked and processed food. And when we switch to raw food, then the body doesn't need too much of stress, because plant food itself has lots of enzyme to digest the food itself. So body doesn't have to exert too much of pressure over itself, and body can very well perform the very vital functions of immunity, very vital functions of cellular repair, regeneration, and that itself gives a feeling of high energy and being a livelihoodness and enthusiasm and high stamina.
Correct. Great. So Bela Didi, aapne, you had raised your hand once again. Why don't you share? Go ahead.
I have a question, and I got 2 questions. And
go ahead, please.
I'm with this diet and everything is fine. There is any indicators that tells you, how much you eat by age wise or something that you can, and then your body or your mind or somebody tells you, hey, this is what's going on. It's just like you got a headache, you take a Tylenol and you feel better and you're done. Same kind of thing. And the second question is that 1 + 1 is 2, 5 - 3 is 2. But there's a difference. How can you see the difference between 1 + 1 is 2 and 5 - 3 is 2? So my question is there some kind of ways that you can know, okay, I know I'm not physically, mentally, you will know this is what going on. I'm very close what I'm doing because everybody explained very much, a lot of things. Half they remember, 1/3 I don't remember. But the question is they getting, okay, eat this kind of food normally every day, and then extras is this. They don't eat this kind of food every day. And that indication, it will satisfy that, yes, I'm getting advice from an expert that make me happy that I'm not doing like a Brazil nut. Is a lot of thing is almond nuts or the cashew nuts a lot, and then a lot of, so all those things. So if somebody can indicate like this much you get vegetables, this much nuts at that age, and it's kind of a not that real law of nature, but it's give you a mental peace or mental, yes, I'm doing fine. Is
Great,
that
great. So I think, no,
anything?
I'll take that question and I'll answer it briefly. In fact, both your questions have the same answer. The indicator that you should use is true hunger. Okay, sometimes you may look at food and you may feel hungry, but that may not be true hunger. True hunger is when you look at food, you don't eat. After some time, if after 10-15 minutes that sensation does not go away, then you are really hungry. Sometimes if that false hunger comes, no, the hunger pang comes. If you wait for a few minutes, 10 to 15 minutes, that hunger pang will go away. You don't have to really eat at that time. When we eat when we are truly hungry, then what to eat, that wisdom will dawn within us. See, once you eat whatever you eat, the body doesn't really distinguish what you have eaten. Okay, the body will break everything down into individual ingredients and then rebuild from whatever you give to the body. Okay, so there are people who eat only one type of diet. It's called mono diet. So from that one single thing itself, the body is able to extract whatever it requires to sustain the body. See, you imagine there are other animals that are naturally huge. For example, an elephant is huge, or a hippopotamus is huge, a cow is huge, but they are eating only grass. How are they converting that green grass into protein? Whatever protein they require from that, they are able to extract. They are able to store it. Even our body is similarly capable. Unfortunately, what happens is because we are overfeeding the body all the time, our body's capability of converting whatever we eat into the right kind of ingredients, that capability has gone down. We have to improve that capability through intermittent fasting. That's what happens. In your case, because you talk to us once every week, we are always able to figure out, what you have eaten in the past week, what kind of improvements you need to make. And of course, you saw that nice table Dr. Aniket Inamdar showed us in the presentation, right? That table is in Shweta's head. Supposed to be. Shweta, Aikini. So whenever you ask any questions, Shweta knows that's the ingredient you need. That's the nutrient that may be deficient. And that's why she tells us, isn't it? Shweta, why don't you answer this question hereafter?
Yes, definitely. So, Matuji, to your first question, I would say we need not quantify things, but if at all we see the RDA, as per the RDA at your age, you should be having more of raw salads and fruits because you need more of vitamins and minerals compared to carbohydrates and energy. That is what it is according to the books. Okay. So what we do is, any which ways in this diet, we will be asking you to have more salads or food in the diet. So you are any which ways getting all kinds of fibers. You are getting good amount of proteins, calcium, everything is there in your diet. Okay. So you don't have to worry about how much you are eating and whether you should eat that much or no. That is as per your hunger. Second thing is your appetite. Gradually, when you go on succeeding on this diet, your appetite is any which way is going to go down, because your body will be able to efficiently make whatever it requires from whatever amount of food you eat, and the appetite goes down eventually. That has happened with each one of us. That is one more thing. And I forgot your second question. What was that?
The first one was, is there any guidance like this? And secondly, what to eat? I think that's what you were asking, right, Matuji?
Yes. My question is that all those different foods and different vegetables, there is some kind of indicator that tells me you got to have a little carrot, little apple, little this and a little this. And so you have a basic food. And then after that, whatever extras you can take, that's okay. But you should have that many in the morning or whenever you are really hungry. So that was my trying to be pinpoint that at my age or something, people have a problem with the digestive later on in life. So that's what my question was, that, hey, I got my 2 carrots, I got my lettuce, I got my, don't need tomato, I got my apple. So I have some, so that confidence built in that makes feel that, yes, I'm doing right.
Right.
So
So it
Shweta,
depends very much. Yeah,
go ahead.
actually it depends very much on your individual requirement also. Suppose if your diet has no, like initially there was no salads, no fruits in the diet as much. So then that means fiber was lacking in the diets. That's why we started introducing that. Suppose if your biochemical parameters show that there is lack of hemoglobin, if the hemoglobin is less, then we will ask you to include more foods which will have more iron, which will give you more iron, more hemoglobin, so that your hemoglobin is normal. Okay, that way. But otherwise, it is as per your hunger that you have to eat. As of now, whatever we are doing is perfect. That is what you need to know. And as per the, if you want to know how many nuts and all you have to eat every day, so that is like a fistful of nuts all together. हमारे एक handful में जितना भी आएगा each individual, that much only per day you can eat, because those are like almost 15-20 grams of nuts, which give you almost around, say, about 100, 150 or maybe 200 calories. And plus they are going to give you good amount of proteins, 7 to 8 grams of proteins, which will be sufficient. Now this protein and these calories are again in the soaked form. So the bioavailability, as we spoke about it, the more when you soak it and have it, automatically the fiber is also going, protein is there, calcium, zinc, whichever element you name, and each and every mineral, micronutrient is present in all the nuts. So that is the quantification. You need not really list down key how many you have to, unless you have any medical background, any medical history. Say suppose if somebody has diabetes, then you should not be having more of dates or more of raisins or something which is very sweet. So then we would ask you to substitute it with some other food, that way.
Good.
See, that's why we have this individualized program, and we will advise each individual separately once every week. Vasant Shetty has raised his hand. So Vasant, can you please unmute yourself?
Before that, I'd like to ask a question that was missed in the chat. So
Okay,
I'll
go
go ahead
ahead,
and
please.
ask that. Maybe Dr. Aniket can answer that. It's related to intermittent fasting. I think Shraddha ji asked that should we worry about hair loss or
Correct.
some side effects of intermittent fasting or any kind of fasting. So Dr. Aniket, you want to take that since you spoke about research on intermittent fasting? And you're on mute, Dr. Aniket.
Actually, what intermittent fasting does, it does the metabolic switching, Pooja. So this metabolic switching happens. But what happens when we eat regularly and frequently? The main source of energy for the body, especially for the cells and the brain, is glucose, right? So when we go on intermittent fasting, body is deprived of this essential, energy-giving source, that is the glucose. So then what the body does, body switches goes to ketones. So what happens? The body goes into a process of utilizing its ketones. So increased amounts of ketones will be there in the intermittent fasting period, and that ketones will be utilized by each and every cell of the body, including the brain. So brain cells also utilize these ketones. So what are the benefits of having ketones as a main fuel of the body? So ketones have itself has an important anti-carcinogenic and anti-inflammatory effect throughout our body. So ketones will help in cell repair and cell regeneration. Ketones will try to reduce your insulin levels. Ketones will try to reduce your inflammatory stress. Ketones will try to reduce your oxidative stress in the body, and it improves your cellular functioning, mitochondrial functioning, and ultimately all organ cleansing will be there, and the more health and vitality you can experience. Only some people have definitely experienced the problems like hair loss, which cannot be very well experienced in all the recent studies that I have been gone through about the intermittent fasting. There is no such clear-cut explanation that why some people have experienced the hair loss. But I don't think it will remain slow and steady, and as per the individual requirement of individual fasting, I don't think that people will experience this kind of a hair loss. When we directly do the 16 to 8 hours of fasting in the first week itself, then body gets deprived of essential nutrients, especially the zinc and the boron and the biophotons, which are essential for the cell growth. That may occur in the initial period, but the slow and steady and the individualized approach to the intermittent fasting will definitely give you remarkable results without any side effects.
Great. Thank you, Dr. Aniket. There is one other question before we come to Vasan Shetty. There is one question or comment by Bula Didi. I have one question on making sprouts. I consume it every day, but do not make every day. Any advice on it, please? So should sprouts be eaten every day? And my answer is no, because I rarely eat sprouts these days and I'm still fine. Most of my protein and fat comes from soaked nuts. So not really necessary, but if you do the sprouts, great. If you like sprouts, wonderful. You should eat those, no problem. Vasan Shetty, can you please unmute yourself?
Now, my question is, suppose when I am Vasan Shetty from Mumbai, my question is that people, they follow these natural diet and other things, and what about the source of calcium? Suppose if I am going for a vegan diet, so they said that in vegan diet there is no good amount of calcium. So how we should compensate for this calcium? Suppose if I go on a
Wonderful. I'll
vegan
let
diet.
our sister Shweta answer it.
Yes, I'll take this.
Okay.
So there is a lot of calcium in raw diet. It's not that vegan diet is lacking in calcium. All the green leafy vegetables that we eat have good amount of calcium in it. Plus the seeds that we just mentioned, all kind of oil seeds and nuts are very rich source of calcium. So the best source, the maximum calcium which we can find is in sesame seeds. So तीळ जे असतात ना, तिळामध्ये खूप आहे calcium. So once you if you decide to switch on a vegan diet, you should see to it that you include good amount of sesame seeds, and as per the season change also, we would advise different seeds to include in the diet to all the participants. So sesame seeds, almonds, walnuts, all these have good amount of calcium in it. Plus there are certain fruits also which give you calcium. And another thing is the vegetables that we eat, whichever vegetable raw seasonal which we can eat, that is also going to help us give calcium. And other thing is metabolically, if you see, whenever we are having high protein diet, suppose if you are having milk or if we have good amount of eggs or meat in the diet, then it is actually the base of all these proteins is amino acids. So when we have a high protein diet, basically the blood pH changes, it becomes acidic. When the blood pH is acidic, it tries to leach calcium from the bones to make it alkaline. The bones act like a buffer. So when we try to reduce this animal protein in the diet and when we have more of vegan protein, then actually this thing need not happen in the blood, and the blood is already alkaline. We produce alkaline as diet when we are on a vegan diet, and that is one more benefit of it. So we don't require that much calcium from the diet, and whatever we consume has good amount of calcium in it, and which gets absorbed very nicely. I hope that answers your question.
Yeah, one more thing just I want to add here, Shweta.
Yes.
Actually, calcium, as you said rightly, the important sources of vegan sources of calcium. One more thing, just I want to ask all the participants to make sure that you have at least 15 to 20 minutes of sun exposure early in the morning, because vitamin D is very important for the calcium to get absorbed. So that is very important, because nowadays people are rarely having minimal 15 to 20 minutes of sun exposure. So that is very much required for the calcium to be metabolized. Vitamin D is an essential ingredient for all sorts of diseases. Now, even the research has shown that the people who have very less amount of vitamin D are more prone for all sorts of chronic diseases, including cancers, heart attacks, and diabetes. So make sure that all of us are having at least 15 to 20 minutes of sun exposure, especially early in the morning.
Great, wonderful. Our sister Pooja can now close this meeting if Pooja is ready.
Yes, I am. So thank you so much, Dr. Aniket, for for this insightful session. I think we've had a lot of sessions earlier on natural diet, but then hearing this from a medical doctor brings in a completely different perspective. Because this is backed by medical evidence and also so that endorses what we are doing, and we are sure that whoever follows this diet will definitely get the benefits, the ones that we spoke about in this session. So thank you very much for making time for this session and sharing your insights with our audience.
Thank you, Pooja. I thank Dada and Shweta also for giving me this opportunity, wonderful opportunity for sharing my insights of scientific evidence into the diet purification with my own transformative journey. Thank you.
Great. Wonderful. Everybody in Bharat, you have a wonderful evening. People in America, you have a nice day ahead. We'll talk to you again sometime soon. We'll make the announcement when we'll have the next Sundays with Sattva program. Thank you very much.